Okay, so this presentation is on promoting physical activity, and it's by Kaylee Smith and Nicole Keller, who are nursing students at BYU, Idaho. So, physical inactivity is a major problem among adults in the United States, and more than 80% of adults do not meet the aerobic and muscle strengthening guidelines that are given to them. This is important because physical activity can actually decrease the risk of many health problems. Some of these health problems include coronary heart disease, hypertension, type 2 diabetes, osteoporosis, depression, anxiety, obesity, and also certain cancers. Because it is so important, Healthy People 2020 actually established a goal based on physical activity. Their goal is to improve health, fitness, and quality of life through daily physical activity. And not only do most people not meet the guidelines for physical activity, but 1 in 5 adults worldwide is actually physically inactive, or sedentary, in other words. So physical activity is decreasing, and being sedentary is increasing. This problem of physical inactivity is more prevalent in developed countries. Developed countries, for example, is the United States, Canada, those type of places. Physical inactivity is also directly related to adult obesity, and obesity is a major factor in the development of many chronic diseases. Being physically inactive also puts adults at risk for diabetes, cardiovascular disease, and cancer, along with many other health problems. Physical inactivity also reduces life expectancy. Being physically active actually has an effect on the economy. If you're not active, it decreases the worker productivity in companies. It also increases absenteeism in the workplace. Studies actually show that adults who participate in sports or physical activity during the week have an average of 8 to 10 days less sick leave a year. Not being physically active also increases medical costs, and this tends to be because they have more chronic illnesses. But these costs do continue throughout life and is a recurring expense. Some of these costs come because of physician services, medications, ambulance services, rehabilitation, and hospitalizations.
With regards to exercise, political, ethical, and legal issues don't really have much of an impact on people trying to become active. I mean, it's to exercise illegally, you'd have to be working pretty hard to do that. And ethically, the only thing that you really might come across is just, I guess it kind of can intertwine a little bit with cultural, is if your family or friends are against you becoming active because it makes them feel uncomfortable, kind of thing. But cultural issues are really the big thing that I wanted to focus on here. People tend to be more comfortable around those who are at the same fitness level. And if somebody's breaking away from that, then they're often made fun of or even disassociated from the group just because they're not doing the same thing that they always have done. If they're trying to become physically active, a lot of times people will relapse just because the people that they hang around aren't as physically active as they are, or vice versa. Is not quite so physically active and starts hanging out with a group that is physically active, they'll most likely kind of revert to that. And not only in our associations, but also our culture, as in where we're from. Typically, people from different countries have different physical activity levels. take for instance, Mexico's now surpassed America as the fattest country in the world. They, if you're in that cultural setting, I mean, they enjoy lots of food, things like that. We're in America the same way too. We um, typically do more fatty foods rather than the rice and beans that people say from Brazil eat, and they're typically more active and more able to get up and move around, probably because the food they eat doesn't make them want to sit around for 3 hours.
Okay, so going along with physical activity, there are many community programs and resources that are trying to improve physical activity through our locally, statewide, and nationally. And we'll discuss an example of all the three categories: a local resource, a state resource, and a national resource. So one local program that is working to improve physical activity is the Nashville Area Metropolitan Planning Organization. So in the Nashville area, they are working to promote active transportation. Active transportation are such things such as walking, biking, and using public transit instead of everybody driving their cars. They are working to provide more sidewalks, bike lanes, and greenways. They're also working to improve physical activity by providing education on the effects of air quality, such as asthma, heart disease, and diabetes. There are many local problems near you, and some examples are just even a gym near you can promote physical activity. So it's important to know what's around you and to find ways to help you. One example of a state program is in Arkansas. Arkansas has the Arkansas Healthy Employee Lifestyle Program. This works specifically with state employees, but they work to increase healthy behaviors at state employee work sites by promoting physical activity, eating healthy, obtaining health screenings, and avoiding or quitting tobacco products. They actually give incentives to employees to participate in these programs, and they offer education to all their employees on nutrition, weight management, tobacco cessation, and physical activity. They also have support groups they do this by offering participation in group activities, and you can also be part of different group challenges. They specifically did this at each work site by either adding walking areas, like designated walking areas. They did either around the building or like outside or inside, and actual like walking paths to designated walking areas so that they can go on walks during work breaks or lunch hours or whatever, uninterrupted. And they also, some of the work sites also added fitness rooms with treadmills and TVs and stuff so that they can do it that way if they didn't have a area that they could do a designated walking area. And as of March 2013, AHELP is what the abbreviations for Arkansas Healthy Employee Lifestyle Program. They actually have been implemented in 30 state agencies and more than 500 worksite locations around the state of Arkansas. So it's definitely caught on, and they're doing a good job with that. There are also a lot of national programs working to improve physical activity. I was able to find a lot of different options, but the one program I chose to focus on is the National Coalition for Promoting Physical Activity. And this coalition is actually a blend of associations, health organizations, and private corporations. And together they advocate for policies that encourage Americans to be physically active. They advocate for policies in schools, in the community and healthcare systems. They even use the media and work with policymakers to create a physically active population and develop active environments. Some of the policies that they work towards is by increasing parks and different outdoor venues. They also advocate for an increase in recess and classroom breaks, like in elementary schools. And they've also even worked with the college level to increase intramural sports. They also have advocated for like active transportation, working with kind of the same thing that the Nashville area did, but working to promote active transportation. So in all areas of healthcare, you can kind of look at levels of prevention. And there's 3 levels of prevention. There's primary, secondary, and tertiary. Primary prevention focuses on promoting health and preventing problems before a problem even develops. They target healthy individuals and provide education to prevent problems. In this situation, providing education about exercise to prevent people from having a disease or health problem would be a primary prevention. Another example of primary prevention would be immunizing against a vaccine-preventable disease. So all the vaccinations we give to children at their well child visits, that is acting in primary prevention. So secondary level of prevention basically detects and treats problems in their early stages. They provide education and health screenings and they target populations at risk for problems and then work with those populations to shorten the duration and severity of problems they're experiencing. So in this case, targeted populations would be those at risk for health problems like obesity, hypertension, hyperglycemia, or hypercholesteremia, high cholesterol. And tertiary focuses on improving quality of life and reducing symptoms of a disease that already exists. So they would target populations that already have a disease or injury and then focus on limiting further negative effects related to those diseases. And with physical activity, individuals may work with healthcare providers to improve their quality of life through physical activity when they're diagnosed with such illnesses such as obesity or hypertension. So each of the community resources we discussed can be categorized into a level of prevention. The levels of preventions, again, are primary, secondary, and tertiary. So the National Coalition for Promoting Physical Activity could fall under the primary level of prevention because they are providing education and making changes in the community by promoting physical activity. And they're not really focused on one specific risk population. They are just basically promoting the prevention of problems. And the Arkansas Healthy Employee Lifestyle Program is probably a secondary prevention because they are providing education and health screenings to their employees, and they're specific to those at risk for these health problems because of being in the workplace, which kind of promotes this sedentary lifestyle by sitting at a desk all day. So they're promoting and preventing those problems in those at-risk individuals. The Nashville Area Metropolitan Planning Organization is also a secondary prevention level because they are targeting individuals at risk because of limited physical activity due to transportation, and they are also providing and promoting education to those at-risk individuals.
In the nursing community, there's things called nursing diagnoses. They're diagnoses that doctors don't typically make because they're able to make more cleanses than we are. but nurses can make things like risk for activity intolerance. They can make diagnoses like risk for impaired oxygen exchange in people with like things like pneumonia. So risk for activity intolerance is the one that I wanted to focus on with our wellness plan. That just means that people who are inactive and trying to become active have a not being able to tolerate that very well. With any nursing diagnosis, we typically put interventions along with it, like teaching, things we want to teach, things that we want to focus on so that somebody can completely understand where we're coming from and why we think that this nursing diagnosis is important and why it should be focused on these patients or these people aged 20 to 30 or so. So the interventions, and then after the interventions, we want to focus on the goals, the end goal. So why is this important? Why are we looking at this? So that we can reach this end goal. What end goal do we want to reach after overcoming this nursing diagnosis? So this intervention, activity intolerance, the main one, is teaching the importance of exercising and the health benefits, so that they can fully understand why it is that they need to exercise. There was, I can't remember exactly who said it, but it was an apostle in the LDS church. He said, teaching people to understand, or like studying doctrine helps change behavior more than the study of behavior changes behavior. So if we teach them the reasons why rather than what can come about, that's going to really motivate people to exercise more than anything else. So, for example, if we teach people, hey, it can help your body, it can increase the cells in your body that produce energy so that you're going to eventually have more energy. It can prevent cancer, it can prevent lots of different health-related issues that are more prominent in people who are obese. Rather than saying, oh, you'll look good if you do it, which might be an end goal, but to get there, a lot of times that isn't enough. That isn't enough motivation for people to really exercise that they need to. I had a couple of roommates one time that posted all over the entire apartment, like, do it for the beach, do it for the bikini body or whatever, and they stopped exercising a week later because they couldn't do it anymore. They didn't have that correct motivation that they needed in order to really truly change their lifestyle. They just reverted back to the way that they were before. You have to have, kind of as the scriptures say, a change of heart in order to really go about this exercising the way that you need to. The three main end goals that we were thinking of with this risk for activity intolerance were controlling your weight, boosting your energy, and battling health conditions. So on controlling your, a lot of people are more overweight than they realize. BMI is a good tool to start off with, but that doesn't give you all of the information that you need. So, for example, you might be 6 foot tall and weigh 400 pounds, and obviously you're going to be in the obese category. But you also might be 6 foot tall and weigh 170 pounds, which is a good weight for that height. But you might be inactive. So your weight is technically controlled, but that doesn't mean that your fat composition is controlled. So you still might have a lot more fat compared to if you don't exercise appropriately. So that needs to be taken into consideration, both your weight and your height and your fat composition. Somebody might be 5'2" and weigh, 150, 170 pounds, and that's overweight for them. But if all of it's muscle, that's still pretty healthy for them. if they're like a boxer or something like that, the exercise is quite a. The second one I wanted to focus on was boosting your energy as the end goal. In your cells, there are little organelles known as mitochondria, and they're responsible for producing something called ATP, which is the body's energy source. It's what your entire body uses to um, do anything, whether it's muscle contracting, whether it's chewing, walking around, anything like that. Your body needs ATP in order to be able to work. So when your body thinks, oh, I need more mitochondria to be able to keep up with my daily activities because I'm exercising a ton. And so your body produces more mitochondria. And so in the end, on those days when you're wanting to be lazy, you have more energy because your body has mitochondria to compensate for that. But if you're sedentary, if you're sitting around all day eating potato chips, your body thinks, oh, I'm not doing much. I don't need mitochondria to make this ATP. I don't need as much of it. So I'm going to conserve my own energy, stop making mitochondria. So that's when so the more lazy you are, the less energy that you have. The more active you are, the more energy you're going to have. And then the last one is battling health conditions. If you are more active, your body is capable of fighting diseases more. People who are physically active and have their weight under control typically recover from illnesses faster. They are able to prevent cancer, prevent things like osteoarthritis. People with more weight on them obviously it's gonna be harder on their joints than people with not as much weight on them. It also prevents just lots of different health related problems because your body is more capable of them rather than being sedentary or sitting around all day. So again, to kind of reiterate, the main nursing diagnosis we were thinking of is risk for activity intolerance when it comes to exercise. Interventions are we need to help people completely understand why it is that you need to exercise rather than just looking at that end goal. And then the end goals that you want to be focusing on, one more than the other, is controlling your weight, boosting your energy, and battling health conditions. And that's going to help people really change more than just wanting a good-looking body.
Thank you for listening and reviewing our presentation with us. We hope you have learned a lot about the importance of physical activity.